Idaho has one of the highest suicide rates in the nation, and tonight's Finding Hope, our Natasha Williams looks at one part of the effort to bring those numbers down in rural areas.
There's something special about rural communities in that they tend to be there for each other. But what individuals within rural communities also struggle is that they don't know how to help. Even if they did want to help somebody who was struggling, is they don't know how.
Dr. Clarissa Richardson has been studying mental health in Idaho's rural communities for years, working towards solutions to bring rural suicide rates down.
The research says you need to do community-based work. You need to get the community involved in the process.
Richardson explains there are multiple factors behind the high suicide rates in those areas, including the stigma surrounding mental illness, ready access to firearms, a lack of mental health resources, and what experts call a rugged mentality, the mindset you don't need to seek help.
We see these as risk factors in rural areas, and so we think, okay, well, what can we do about that?
In Idaho's rural areas, careers like farming are dominant. Experts explain the stresses for farmers' mental health are different than other careers.
For a farmer, if he loses his farm, it's not just the loss of a job. They equate it to the loss of a child. That's how the loss of your farm feels to a farmer, especially for the multi-generational farmers.
Richardson's research has focused on implementing community-based mental health programming in 2 rural communities in northern Idaho. The programs work to educate community members on mental health warning signs and what to do if they see them.
Mental health first aid teaches people how to understand what a mental health issue is and how to empathically respond with understanding to somebody who's struggling, so that that connection can actually decrease the risk of suicide.
Researchers say the programs are a valuable tool in areas where there aren't many mental health resources.
The University of Idaho would eventually like to expand this program so that it's statewide. In Twin Falls, Natasha Williams, Idaho News 6.
If you or someone you know is struggling, please don't hesitate to reach out for help. Call the Suicide Prevention Hotline 208-398-4357. We have a full list of mental health resources on our website, and you can just go to idahonews6.com and then click Finding Hope.